Hello everyone, welcome back to our channel TalktoAngel, where we provide expert insights and support for your mental health journey. I am Samta Parekh, a counseling psychologist at TalktoAngel, and today we are going to talk about panic disorder. Today we have Dr. rksuri, a renowned clinical psychologist with us, who will help us understand what panic disorder is and how to manage it. So, sir, my first question to you is, what are some common symptoms of panic disorder?
In the case of the panic disorder, there is a intense feeling of distress, choking of heart, increased palpitation, breathlessness, butterflies in the stomach, or increased micturition, and the person is feeling that something is going to hamper his functionality. He, and often I find that people are saying that I'm going to die, take me, help me. In many of the cases, I've also noticed that the patient comes to the OPD with a diffuse and confused state of expressing that his heart is sinking, BP is shooting, and I'm going to die. And then it is often mistaken as a heart attack by a patient, and he or she consider that he's going to die. That is one of the reason for in the primary care provider also to get panic and take him into the OPD emergency.
So, my next question to you is, how can we differentiate between panic attacks and generalized anxiety?
So panic attack is a intense phenomena which is happening for a shorter duration of a time, maybe for 5 minutes, 10 minutes. However, generalized anxiety is a longer in duration, which is an impending danger of something wrong is going to happen in future. It could be anxiety of health, it could be anxiety of examination, it could be anxiety of interview, or it could be an anxiety of the son or daughter is not coming home, or losing a job, or a feeling of insecurity. So the generalized anxiety go on for a little longer time. Normally, we say that it should be there for 15 days to 1 month, minimum 1 week to 15 days and 1 month.
That was very informative, sir. What can be some of the potential causes or triggers for a panic attack?
See, the common trigger for a panic attack is the loss of a job, or failure in the examination, or a sudden feeling in that something untoward has happened to himself or to the family, or a shocking news. While in the morning, I was having a one very young boy, 16-year-old. He was appearing in exam, and he got a feeling that he is not going to perform very well, and then he started complaining with the symptom of palpitation in the heart and butterflies, and the panic button was pressed to the mother, father, and everybody then took him to the emergency in the hospital. And then he consulted me. I said, "Ki, it is just a panic attack. We need to take it in a more planned manner and reduce the stresses which the child is facing."
So, my next question to you, sir, is how can somebody differentiate between a panic attack and a medical emergency?
See, the medical emergency now often long for a little longer period, whereas the panic attack normally goes up to 5 to 10 minutes and subsides immediately. Whereas in the case of the heart emergency or the breath emergency, the symptoms are very severe. To not to get panic, it is advisable to take the patient to a medical emergency and get him treated over there. But if it is happening quite often, then one needs to understand that it is the panic attack, not otherwise. So there are other certain things which needs to be taken into consideration. For example, age of a person. If it is more than 50 years, the chances could be a heart attack. So one has to take a serious note on that. But if someone is 15 years, 16 year or 20 year of age, the chances of heart attack would be lesser. The more would be of a panic attack.
So, my next question is, can you give us some tips on how to effectively manage when somebody is having a panic attack?
Well, the most important element for managing a panic attack is listening to the person, giving him a space, and try to understand what are the triggers, why that particular things has happened. In most of the cases, the effective listening and rightful communication and cognitive behavior therapy works as a wonder. However, if the panic attacks are happening quite often, it is advisable to seek a psychiatric consultation also and seek medication anxiolytic. Now, if anxiety is not properly managed, panic attack is not properly managed, it may lead to other disorders. So, it is advisable that a proper consultation be taken from a good clinical psychologist for any kind of panic attack which are happening, which is a alarming signal that the person concerned is getting overwhelmed to an issue or getting impending danger of an anxiety which needs a treatment. Let me give some cases with reference to panic attack. Uh, One of the patient which has consulted me is a 16-year-old boy. He got panic attack on account of being caught red-handed while taking vapes in the school, and he was staying in a hostel. Immediately alarm bell rang. He came to know that he will be suspended, terminated, etc. Immediately he exhibited a symptoms. Immediately there was a manifestation of symptoms in him, feeling jittery, foggy, and he just fumbled down. And immediately he was rushed to a medical emergency. When it was examined in the medical emergency, it was found that his BP is normal, his heart rate is normal, and there was nothing which was conclusive of any kind of a medical emergency. Then he was referred for a counseling session. While exploring onto the counseling session, he says, I have left vapes 2 months back. However, on seeing my results that I have failed in 5 out of 5 papers, I started taking more vapes, and some of my friends informed the authorities. As a result, the authorities got hold of me, and I got panic that my parents will also fire me. My parents would also check me out from the hostel, and all those things resulted into a kind of discontent, and the child started feeling worried, concerned, and as a result he became panicked.
Can you help us understand how online counseling with TalktoAngel can help someone with panic disorder?
First and foremost, any kind of counseling, whether physical counseling in clinic or online counseling, is very useful in the case of panic attack or panic disorder. Patient or a client must understand that he has some psychological distress, stress, and concern which needs to be addressed, and there are certain trigger points which are apparent in the panic attack, whereas those are not directly identified in the generalized anxiety. Now, he or she may seek counseling at TalktoAngel, which has more than 750 clinical psychologists, and psychiatrists on the platform to provide counseling at ease and comfort of being at home and not being judgmental in nature.
Thank you so much, sir, for taking our time and having an interview with us and giving us such an informative and insightful session.
Thank you very much, Samta.
Thank you everyone for joining today. If you or someone that you know is struggling with panic disorder, remember that help is available. You can take online counseling at TalktoAngel. See you in the next episode.